because today we're going to discover, by doing the procedures and what they mean financially, practices can increase their gross revenue by over $2.5 million. It's amazing. And I'm not talking about doing 20 of each procedure. It's really going to be an eye-opener for a lot of doctors out there. Hi, everybody. How are you? Thank you so much. I'm so excited that you've returned to hear another great episode of Dentistry Beyond the Numbers. It's been a great build and very exciting to have you along with us. Last time we really dug into some really interesting clinical aspects. But first, before we get started, I wanted to introduce again my partner in crime, the guy from the left coast, Rolando Mia. How are you, Ro? How is everything? Haven't seen you in a while, and I miss you. How's everything?
Appreciate you inviting me. Really appreciate. I'm learning so much, and I'm looking forward to this one, especially.
This is a big one. This is a big one. This is the one that people don't know how important clinical education can help them. Because today we're going to discover, Ro, we're going to discover, by doing the procedures and what they mean financially, practices can increase their gross revenue by over $2.5 million. It's amazing. And I'm not talking about doing 20 of each procedure. It's really going to be an eye-opener for a lot of doctors out there. So remember, Dentistry Beyond the Numbers, Ro, is for all different levels of dentists. It's dentists that are young, looking for direction, dentists that are midstream, looking to grow their practice, and dentists that are thinking about an exit. And how do we do it? So please, cherry pick or take everything. But we're here to really guide our listeners into what really allows them to have the practice of their dreams. We talked about last time, we started with the dental hamsa, the hand, and we talked about the procedures that discussed what would make a comprehensive treatment planner. You remember those 5 procedures meant so much. We went through it last time. Today, it's a little more exciting. We're going to dive into the numbers and what it means to a practice. We're going to start our few episode-long financial understanding and why that is so important. So, Ro, we really evaluate, I really, through my experience of many years, evaluated what these aspects, what these different procedures brings to a practice. Does bring clinical excellence. It does bring patient satisfaction, which brings us tremendous satisfaction. But when we put our business head on, when we discuss the aspects that keeps our practice growing, has the best staff, have the best materials, how do we do that? And that's what we're going to discuss today.
So wait. Did you say $2.5 million incremental?
Absolutely.
All right. I need to understand that.
That means if you're $1 million or less practice, if you listen to these words and we look at these numbers together, as we're going to take this so you understand it, we are talking really, as we see it, could be close to 3. But I am not talking outlandish numbers. I'm not talking about somebody who says, I don't charge that. We are talking about average numbers and very few procedures done to increase that. It's just a matter of teaching ourselves and our practice the type of dentistry we want to do. So why don't we get into it? Because it's really quite exciting and a lot to cover. So the first procedure in the hand is clear aligners. I feel that there's so many practices that refer this out or don't want to deal with it because they've never dealt with it. But this slide shows us something tremendous. If we went to an Invisalign course and became certified within a week, we could go back to our practices, have clin checks, have guides helping us. If we did 2 procedures, 2 appliances a week, you would end up with $13,000 of added revenue. If we did it for the year, it's 104 at over $670,000 of gross revenue. 2 clear aligners a week. Now, if you take 2 cases a week, if you get really good at it, like some of the docs that I deal with and some of the practices out there, and you end up doing 4 a week, that's 208 cases. That's over $1.3 million a year of gross revenue. It's kind of enlightening when you know that your education, right, Ro, the more you learn, the more you can do. It's really amazing.
And that's 1,300,000 clear gross, right?
Just that's gross revenue.
Wow.
It's at about $1 million of top line, maybe 1,200,000 with after the lab costs. So if you're having your associate do it, think about doctors. You're adding about $500,000 to $600,000 of net after the doctor in the lab is paid. That's 4 a week. Doctors coming out are
Awesome.
all certified for Invisalign.
Awesome.
Let's go to finger number 2. It's kind of exciting because what I see out there is young doctors fearful or uncertain about root canal therapy. It's probably the most feared specialty out there. And because I imagine teeth can fail, sensitive in its procedures. But today with rotary endo and so much education, as we spoke about last time, if you do 2 a week in your office, that's 2 teeth in the entire week that get a root canal, no lab costs. That's over $220,000 of gross revenue. And if you do 4 or 5 a week, you're over 450,000. So that's kind of mind-boggling that we automatically become a referral service when it comes to root canal. If they come into our office, we say, "Oh, let's go see Dr. Smith," rather than put him in a room for an hour and all the teachings and the podcasts or the videos that you could learn, you could do those root canals efficiently in your own practice, which helps your patients and your bottom line. Kind of amazing. The next finger is something that's extremely valuable to me in that having my experience of practicing in a Upper West Side, Lincoln Center, New York area, we did a lot of cosmetics. And so many people are afraid they'll either do a bonding. And here it's explaining the difference between a bonding case and somebody who's efficient and wanting to do cosmetic veneer cases. I know somebody who his practice is geared towards veneers. He does maybe 50 veneers in a week. But what happens if you did 2 cases? 2 cases a week. That's an added $30,000 as opposed to bonding at about $7,000. You're adding over $1.5 million on a yearly basis if you did 100 cases. That means when patients come in and they want their spaces closed, want the dark teeth covered, they want their bondings out. Veneers are still the best procedure we can do for our patients. It's a matter of becoming efficient and having a system for it. It's kind of mind-boggling if you think about all the procedures we do, and if you break them down, how much productivity does get added as we slowly, incrementally add that to our practice. Let's take a look at finger number 4. I think finger number 4 is an extremely important standard of care. And I say that because so many dentists today are not extracting and bone grafting. And yet dentistry has said this is the standard of care. And I know a lot of us know it, but we would never be able to revisit that patient with an implant on number 30 or 18 if we didn't bone graft. So we're simply just taking the tooth out. But look at the situation if you did bone graft, if you did extractions and bone graft. You're adding, for bone grafts alone, you're adding $125,000. But most important, the clinical excellence you're delivering to your patients, because that's what this is about. Clinical excellence leads to more productivity and more profitability. But if a practice is not extracting teeth and they're referring out, if we could just look at the next slide. The next slide shows if we did both. If we did both extraction and bone graft when we never did surgical extractions, we never hemisected and elevated out those root tips, that's an additional $600,000 doing about 1 to 2 a day, which means you're talking about emergencies, teeth that are treatment planned to come out. If we're referring them out to Dr. Jones and not increasing our productivity, there are so many young doctors out there that are leaning and have a real desire to go into surgery, and they want to do it from a general dentistry component, a dental dentistry advantage. I think it's wonderful. And I do want to say a little caveat. A caveat is that when I interview doctors and I'm interviewing them for a position, My first question is, what do you like to do most? Honestly, if they say bondings, it's a little disappointing. I'd like doctors today that are very interested in surgery, not to be oral surgeons, but to do what needs to be done. I find those are the clinicians, whether young or old, that are more so addressing the mouth as first of all, as a whole, and removing the disease and the infection becomes paramount. With this knowledge, as we discussed last time, you become a comprehensive treatment planner. And now you're adding $600,000 to your top line revenue. Kind of excited. The fifth finger is dental implants. Right now, it has been for a number of years the fastest growing procedure in dentistry. In our practice, we try not to do removable because implants are such a satisfactory type of procedure for both the patient and the doctor. But let's look at the numbers. If you did 2 per week, 2 implants per week, that means 2 single teeth implants, you're looking at over $250,000 increase to your gross revenue. If you did 8 a week, and I know many practices refer out 15, 20 implants. If you did 8 a week, that'll be 32 a month. You're looking at about 380. That's $1 million in just implant placement. Then there's the abutment and there are the crowns. But what we're going to talk about is also how being able to do those type of procedures opens you up to so many more different types of procedures, more all on 4, all on X's, which a lot of general dentists are getting into because they love implant dentistry. And today with guided implants and technology, it's really an unbelievable asset to bring to our patients and to our practice. The ADA came out with a study that said over 70%, 70% of the patients that came in wanted to stay in one practice for all their treatment. It's a little bit of a hardship. It's a little hassle, whatever town or city you're in, for patients to go reschedule with somebody to get teeth and to come back and do that. If we could do it in our office, I find that's what patients are looking for today. But what I want to do is tie all these crazy numbers that I just said to you in one slide. And, Ro, if you look at this slide and you take this slide and it's 2 procedures of everything I spoke about, 2 clear aligners every week, 2 root canal therapy every week, 2 veneer cases, 2 extraction bone grafts, 2 implants. You increase your top line revenue by almost $55,000. I'm not asking you to do 10 implants, 2 implants a week. That increases your top line by $2.8 million. All I'm doing is learning the procedures that I've been taught in dental school and taking it and bringing it into my practice as an efficient basis. That it's so exciting to know that if we just become great at our craft, if we take what we've learned and believe and become great, our patients will benefit, our practice will benefit, our family would benefit. It's an amazing, it really is very, very enlightening and exciting to bring this to you, because I think if I was 20, 25 years younger and starting out a little bit and didn't have the experience, I would gravitate to this tremendously, because this is what gets us
So wait a minute.
and money.
Yeah, I'm looking at this. It's 10 additional procedures that you're adding, not hundreds. And you can pick and choose depending, or you don't have to bring them all on at once, right? If you were to start, if someone were to start down this road, what would you recommend they start with? Which of these 5 procedures that they start with?
Yeah, I think the most important aspect or the most important procedures we could do is getting people out of pain. We need to start with addressing patients' needs. Number 1, root canal therapy and surgery and extractions and bone graft.
So those 2 start
because
with
those 2, from those 2, you're born out so many procedures. If you save the tooth with the root canal, it's a post-corner crown. If you do ridge preservation with a bone graft and an extraction, your patient may say to your doctor, I'm not ready to do that implant. But I tell the patient, Mary, we did a socket preservation where we put grafting in. We're going to let 6 to 8 weeks that grafting settle. I'd like you to come back and let's look at the quality of bone. Then we can decide. Oh, good, doctor. Thank you. But if we don't do that bone graft, if we don't do what the standard of care calls for, then we'll never have an opportunity to go back bone grafted. It's a much more aggressive procedure to then start doing grafting of bone to put an implant when a bone grafting at the time of extraction would do. So I think the basis or the fundamentals are built out with that. Bro, if you think about it from there, you have cosmetics, you have Invisalign, you have implants. It's sort of the substructure is the foundation. The root canal is the bone. The upstructure or the suprastructure, as we call it in dentistry, is the moving of teeth, cosmetics, and then, of course, implants and crowns.
So start with the root canal and the extractions. Then Invisalign would be logically the next step if you were to suggest it. Then you can pick and choose after. Is that right?
Yeah, I think we're so blessed in the profession today. Students are coming out of dental school, like we touched on last episode. They're already certified in Invisalign. They already are in their residency, have touched Invisalign. They know about Crown and Bridge. They all want to do implants. They're coming to the water, bringing that to fruition is amazing because you have the things that they come out with. They don't love to do root canals. We need to show them as mentors, as docs that have been through it with my experience, why root canals are so good for your patient. And not that we want to give root canals, it's not, but if they need it, we want to deliver it and deliver it well. And for a doctor who's getting their feet wet in the industry, having that under their armamentarium is really, really amazing. It's really excellent. And if you take a look at the consistency of our 5 procedures, of our Hamsa, we are building something that's really special, explaining the clinical excellence, because that's paramount. Explaining how these clinical excellence is really a function of financial understanding. In the coming episode, we're going to discuss getting a practice to understand, literally looking at the percentages of labs and supplies and everything that goes into a practice and the makeup of delivering a quality office and what percentages should we shoot for. And if we could do 50% more profit by lowering these costs, by understanding that my supplies have to be a certain number, by my rent or my renovation costs. These are percentages that we're going to talk about. It's not going to happen overnight, but these are what we should be shooting for. Understanding when to give raises and when not to. These all fall into expenses. And next episode, I'm sorry, I'm a dentist like you are. I go by visits and procedures, but next episode, we are going to talk about how important it is to live in the parameters and so we pay ourselves first. We can have 50% more profit and getting ready for that fantastic exit. I'm so excited that not only you, Ro, you're here. I know this was an action-packed, a lot of numbers, but I'm really excited that everybody has joined and is coming along this ride of understanding really what it is in a practice. I know marketing is, and I do want to end our episode, but I do know marketing is very important. But let's say you bring in 60 patients in a month, yet you're referring 20 out for root canals, 5 out for implants, and you're not so comfortable with Invisalign yet. What good is the marketing dollars if we don't have the procedures in our office that are developing our practice and our productivity? That's what I want you to start thinking about. How do I bring these procedures into my practice? And I'll show you next time how these procedures and understanding the finances of our practice brings you great profitability in our search to become that doctor of EBITDA. See you next week, everybody. Thank you so much. I'm having so much fun.